Hello, I'm Stephen Rich from Baltimore, Maryland, and I have the pleasure today of interviewing Dr. Ali Shalash from Egypt. We're coming to you from Copenhagen from the MDS annual meeting, and this is August 27th, 2023. Dr. Shalash, thank you for the interview. I just wanted to show before that you just received these two plaques, and I'd like to just call attention to those. Because you had been the Education Committee Chair of the MDS, MDS African session, and then this plaque was for serving on the Executive Committee of the section. So congratulations on
Thank you
those.
for having me. Thank you.
You're welcome. Well, let's go back here. Can you tell us a little bit about your upbringing and your training?
Okay, I live in Cairo, Egypt, and I completed my medical school in Ain Shams University, Faculty of Medicine, and completed in 1998. And then I became a resident in the Neurology department in our faculty, and completed my master's degree after that about 3 years. It was in pain. Then I completed my PhD thesis. It was in surgical treatment of movement disorders.
Right.
I think in 2002, I think so. So I became a lecturer in my department, then associate professor. Now I am professor and the head of movement disorder group in our department.
Oh, congratulations. Oh. Good. Even before that, though, just tell us a little bit about your upbringing, your family.
Yes. Okay. I am from average family. My father was a teacher, and also my mother, and have 3 brothers and 1 sister, and we lived in Cairo, one of the neighbors there. And I was like, you can say, active or have good scores in my study, and so I got good grades to participate in the Faculty of Medicine in Egypt. So maybe I'm the first doctor in my family or close family, so it was like challenging for me. Have to get like support from other colleagues and so on, but to the usual upbringing. I mean, I would just have few activities. Maybe I've participated in Scout in my university, so became member of the International Scout Society. So,
and what got you? Why did you want to become a doctor?
Actually, my father advised me to do that. This is from my childhood, and he said, you will be the doctor of the family, because all my brothers are like engineering and other. So I thought, it is like important mission to help people, to diagnose people, to work with people. And I like to be a physician, to give solutions and help patients, whatever the specialty.
And then can you tell us how you got interested in neurology, and then specifically movement disorders?
Yeah. So I like neurology from my study in the faculty, because this specific chapter or topics related to neurology I was very interested in them. Maybe read more and like to see cases in my residency for neurology, and the same for movement disorders. Despite maybe I thought to be more common subspecialty like stroke, like MS, but I realized that I really like this field, like to read it, like to study it, like to see patients. And it was obvious between my colleague that okay, Ali is good in movement disorders. So it was encouraging me, and then I got the opportunity to get my topic in movement disorder and PhD
Right.
thesis.
Right.
So it was like a part of my interest and part of I got a chance to do this work.
Right.
So despite it was not like promising at this time, regarding the treatment, there is no available genetic testing in Egypt for research, but I follow my my intuition or my interests.
Right. Good. And along the way, who have been some of your mentors?
Okay, so I learned it in my department from my professors in the neurology. Not all of them are interested in movement disorders, but maybe few, one or two. Maybe Dr. Ahmed Gaber, Professor Ahmed Gaber. He was one of my supervisors, and he's interested in advances in neurology and in movement disorders and epilepsy, and also expert in these cases. So I learned from them a lot. Then I tried to gain more experience. I went to short fellowships. I went to Kiel with Professor Deutschel, 3 months, and also UCL with Rothwell, Professor Rothwell, and I tried to upgrade myself. And of course, I also MDS played a good role for my development, for develop more experience, more seeing more cases, attend more courses. So this is how I can try to build my career, to build myself in this field.
And then in terms of DBS, I know that's a particular interest. Did you have that interest before you worked with Dr. Deutschel?
Yeah. It was part of my thesis, PhD thesis, surgical treatments. So worked for few cases of DBS and more cases for ablative surgeries.
Right.
So it gave me the way to study this field, and I tried to upgrade and establish this in Egypt with our colleagues. And so I went to Professor Deutschel because his center was working in DBS, and published 2 papers with him, and also get some experience and come back and apply this for our Egyptian patient. And I think we succeeded to establish it in Egypt. Now we are the best center or the famous center for DBS in Egypt. We have a good team for neurologist, neurosurgeon, and this helped us too much. We have experts in our faculty for functional neurosurgery, and we succeeded also with the help of our professors in Egyptian society to include it in the general insurance, and this is what was breakthrough because it's expensive for many of patients. So, and we succeeded with that, and we operated several patients in the last 2 or 3 years. So I'm happy to offer a new service in my country.
Right.
How to do programming for this patient, even those patients who implanted the device outside Egypt.
Right.
So I think we were pioneer as a team in Ain Shams to do this. And now we're building our experience to be good programmers, good team for patient selection. And even we participate as a neurologist interoperatively for assessment with our neurosurgeons. So I'm happy what we did and how we do more. Because for Egypt or other developing countries, it's not easy to establish something like this. So this is something new. I'm happy to be part of it.
Right. And how did you first get involved in the MDS, and what are the activities you're participating in now? We did talk a bit before about some of the recognition you've received through the African section.
See, I really owe a lot for MDS. I came from, as I mentioned, from not known center for movement disorders. Yes, we have good professors for neurology, but I would like to be more expert and build my knowledge. So I remember that I participated annually in the MDS Congress to be part of this and learn more and maybe pay by yourself the ticket and flight and so on. So it was my interest to attend and learn more, and this gave me a great opportunity. And also I participated in different courses, several courses for MDS. So I built my network, I built my knowledge in this field. So it was very helpful, and also I participated in visiting trainee program. So I went to my fellowship through MDS, and the other fellowship was by another society. So I think I tried everything. I participated in LEAP program in the MDS, and I'm graduated in I think 2018 from the LEAP program. Then I applied for International Education Committee, and I spent 2 years. So, okay, when they started the MDS section, because for my interest in this field, they invited me to be a member of Africa Steering Committee in 2017. So also it is a great honor to be one of the creators of the MDS section, Africa section, and was part of this. So, so they told me, Ali, we would like you to chair the education committee. And it was a big challenge because I was the first chair for this section, because this is essentially created. So also it's a challenge. I thought I should apologize for this, but they told me you know MDS better and you have some experience. So we started sharing MDS for now 4 years ago. MDS African Education Committee. So it was all a great challenge. I learned it a lot. I tried to do my best, and I think we did a great job. Regarding we are like a small or recently created section, and also we have a small number of experts in this field, or even neurologists in some of African countries. So with my colleagues, we did a great job. We established our activities. We created innovative courses for Africa. And MDS officers and secretary helped me too much to implement my ideas. If you have a new idea, you can just say it, and if it is applicable, we will work for this. So I think we did a good job. I'm happy and hope to do more, because I'm happy to help or provide many colleagues in Africa who are not like aware or have a good chance to train in Africa for this field, to get the opportunity to be engaged, to deliver the knowledge for them. So it was like a great mission. I'm happy to be part of this, and now I'm completing my engagement and my service in MDS. I was a member for executive committee last 2 years, and now I'm just nominated as a chair-elect for sections. So, you know, I looking back to my journey, maybe I joined MDS 12 years ago. So I think I couldn't dream by this. But what I learned is just you do your best, and you do like any step, and you will get more chances or more opportunities. So this is what happened to me. I remember that my first Congress, nobody knew me. I'm the only one from Egypt, or only 2, 3 from Egypt. And now I have a good network. I learned it a lot. Served as a leader in MDS. So this was really a great dream. Nice,
We've come a long way in a relatively short period of time.
I get good chances to be here, and I hope we still serve this field for our patients, for research, and also for education.
What plans do you have for the African section? Because you're the chair-elect. So what are you thinking about in the future?
Okay, really, I just asked myself this question maybe 2 days ago. So I have to do something more. I would like to think more, but I hope we increase our membership, our training in Africa. I hope we have experts and movements other clinic in each country, in more than one center. So I hope like each patient in Africa easily to find an expert in this field.
Right.
Because maybe in Africa there's like underdiagnosis, under treatment, or maybe even the patient directed to like non-experts or even traditional healers and so on and so on.
Right.
So I hope we can do it,
Mm-hmm.
and we can establish our research, our knowledge related to Africa.
Mm-hmm.
So there's, I think, a lot, many things to do. And I hope, of course, with my colleagues, we can do this.
Have you been able to recruit more neurologists in Egypt to be interested in movement disorders, like among your trainees?
Yeah, of course, yeah. I think also we succeeded to some extent in this. I think when I started to be in this field, to work in this field, I was alone in my department.
Mm-hmm.
And now I have fellows and have more than a PhD student and my other colleagues. It's not too much, but now we are a team.
Mm-hmm.
And we started to encourage other departments.
Mm-hmm.
And now we established or we promoted our chapter for movement disorder in Egypt. And
Mm-hmm.
now I am vice president of the chapter. And we succeeded to establish our annual movement disorder conference and school. And now we have interested teams in several universities and institutes in Egypt. And I think everyone now could see the development in this, like education, like training. Now we have speakers from different countries. We have joint research. So I think also we did a good work locally in Egypt.
Mm-hmm. And with these trainees, what's important to you being a mentor? Because now you're obviously viewed as a leader and a role model. So what's important to you in mentoring these trainees?
Really, first, it is like a good chance to be a mentor.
Mm-hmm.
It is a blessing. So I'm happy to help anyone, not only in my team. I have been contacted by younger colleagues from different universities, even from Africa.
Mm-hmm.
And I'm happy to help them, and they maybe need your opinion for a case, share you one of their cases, maybe would like to do their PhD topic. They would like to, how could we be engaged in MDS? So I am happy that everyone could attach me or contact me, and I tried to help them as much as I could. And I encourage them to participate from our local events. If you can say something, now we are starting our Egyptian PD group, so we can work together and train more people with this research. So I'm trying to apply the MDS model in Egypt.
Right.
And I hope we can do this in different African countries. If we have your teams, you develop movement disorder clinics also. We started to encourage universities and institutes to do their specific movement disorder clinic. So I hope if we could do that in different countries, we will increase the interest and the teams in Africa.
Can you talk a little bit about the LEAP program and how you got involved with that and how it helped you?
I think MDS, it is important that MS care about not only the knowledge, scientific knowledge, but also how to be a leader and how to deal with others, how to work with others in teamwork. So I applied for this. Maybe I rejected. I not approved for 2 times. So I applied for 3 times. It was difficult because I applied through the MDS urban section.
Right.
Before creating the MDS. So I thought it's important program, and I think I learned a lot from it, how to deal, and I think I used part of it, I hope so, or most of it, in my communication with my colleagues, even in my country, how to be leader, how to enable others, how to help others, how to share your vision to the others. So you might be have these values, but someone maybe would like someone to remind you about it, or you can see it, or you just remind to keep applying this in your life, in your work. So I think it's an important program, and also I'm happy that recently MDS created a career development program. It is also including scientific and also including other aspects of career, leadership, research, manuscript reviewing. So I'm really happy that MD is taking care of this, and we need to build leaders for the future, for different sections, especially for Africa. We need to build leaders who can continue and upgrade this work.
Well, it's interesting that you had to keep applying, that you were turned down twice, so that's a tribute to your perseverance.
Yeah. What I just because I'm now preparing a lecture on how to succeed in your career.
Right.
So I thought one of this you should be persistent.
Right.
I remember that's my first Congress. My flight canceled twice. So okay, I know. No, I would like to go. I would like to. I will not miss this Congress. So yeah, you might think it is okay, leave it, you can go to next year. No, any chance or any step, if you size it or catch it, you will get more other chances, or you get more success, and you open the doors for another opportunities.
Right.
So what do they learn it? Whatever this step is small, whatever is not like a big achievement, but small achievements could pave the way for major achievements. And also, I started late. I acknowledge this. I started late after my PhD thesis. And I said, no, everyone in Egypt stay and work in his place after PhD for, to get like income and so on. But no, I said I can start late, but should I start?
Right.
And maybe my wife encouraged me to do this. So I think we should be persistent, and we be rewarded, whatever. Maybe later on, maybe early, but just move. That's what I learned. It maybe I'm not like aware by these values from my start. I did it like spontaneously, but really, if you're persistent and you move, try to catch opportunities. Right. This is better than you just keep in your place and say, okay, I'm good. No, you are not good. You have to see outside, and maybe years later you will be acknowledged. Right. I didn't plan to be like a leader or to be part of section, but my early steps to be engaged in society and engaged in the Congress, maybe was a chance for me to be recognized and to start other missions. So
right. Well, that's good advice.
This is what I learned. This is what I learned. I'm not aware of this. But I'm happy to share this with my younger colleagues.
Right. So being persevering and taking advantage of opportunities and looking for even small accomplishments. They don't always have to be big accomplishments.
I don't say you will not be able to do like others. Maybe you are from small countries, from unrecognized group, but you can make a change. Right. Maybe last year or 2 years ago, we published a paper for Africa in the MDS journal. It was like Movement Disorder Journal. So it was about availability of therapists. So you can do good things by you, even if you don't have like abilities or sources, but you can do something.
Right, right. You mentioned your wife encouraged you. Can you talk a little bit about work-life balance and how you manage that, and maybe a little bit about what your usual week is like as a clinician?
Okay, I'm happy that my wife is not here.
But she can watch the video.
Yeah. Because I told her I might be talk about work home balance. She said no, you are not good in this part because maybe I engaged more in the work. But yeah, it is important that your spouse or your wife encourage you, believe in you, and she did this. She always encouraged me. She said, no, you are able to do that. Go and so on. And maybe I traveled alone without her for my fellowship, so she was encouraging. I'm trying. I advise all my colleagues to make a balance, but really I'm engaged more in work because also in Egypt you have to work a lot in your private clinic. to get a good outcome, to get a good income. So, but of course, I have like weekly assignment to visit my family, my mothers and my brothers, also my wife's family every Friday, and we try to like spend some days and holidays and weekends in other places. So we are working together, and this make easier communication with us, with my wife. So it is important to keep going in your life and you care for your home beside your work. Maybe sometimes you have to, or you sometimes you're obliged to engage more in work, but try to compensate this in other times.
Right, right. It's hard to achieve a real balance all the time.
Yeah. It's not easy, and I think maybe you and everyone like work hard in this field or in the field feel this, and I think our families are partner for our success.
Right, that's true. Within the MDS, have there been people who you can identify that you've really looked up to, that have been role models or that have been mentors for you? And who are they?
Yeah, of course. I don't want to mention exact names, but you know, MDS have like.
But it's okay to mention specific people who have had a positive influence on you.
Okay, you know, maybe you know, in the MDS you will find models for every aspect in your career, not only because you shouldn't have only one model. So I worked with Professor Ferreira for education, and we directed the first MDS school in Africa with him. He was my guide for educational activity. Of course, Professor Deutschel for DBS and DBS writing. Maybe Professor Kalish Patia for clinical sense or clinical approaches. So I am happy to see different models. Maybe even in our section, our colleagues, I learned from them how to be like smart, how to be like how to work with others, and I don't want to forget names, but really we have like models for different aspects of our life in this society. So in DBS you have like good figures, so I try to learn from them. I try to be like a guidance for my colleagues, even if they could like travel to them and so on. So maybe I don't want to forget more. I worked with Professor Elena in some activity, more. So I think we have a good experts and good models in MDS, and this is very inspiring for any one of us.
Right. And what advice, you've talked about this a little bit, but for junior people or trainees who are looking at this video to learn from your career, to view you as a role model, what advice can you give them?
Okay, I advise my colleagues, if I like able to do this, because I still in my like mid way, but my first advice is to be prepared. Be prepared by knowledge. Be a good doctor, good expert, whatever the upcoming steps. But just be prepared, because one time you got a chance, and if you don't have these tools or have not prepared, we couldn't engage in this, take this chance. If you are not like clinically well prepared with knowledge, you can share, present, talk in conferences. You can have an experience about advances. So if I don't have like a background about DBS or movement disorders, I'll not be able to engage in this, in paper writing, or maybe in some presenting talks in in our African activities. So be prepared and be persistent and move on. Just don't say, oh, no, I'm okay with my clinic, with my patient. No, you have to search for more knowledge, search for more opportunities, search for combined research. If you could travel and get a mentor from earlier age or even later on, go ahead. This is will help you a lot in your career. And other thing also, you have to work in team. You will be able to work in team. So like conjoint work and you help each other. This will make your success are more and more. Everyone work for himself or just be isolated for himself will not get the same benefit. Try to work with others, try to help others, try to provide knowledge for others, and learn how to be leader or for how to enable others, support them. So I think this is another important point for everyone who be to succeed. You should be effective. You should have a greater impact for your family, for your teamwork, your department, and you may get the better chance, like everyone, like many in the MDS, to be effective in maybe in continent or maybe all over the world.
Right.
So think about this. You don't want to be just. It is good to be like good for your patients, but you may also have a larger impact globally. I'm happy that everything. Like someone from Asia, Dr. Ali, it is good to join your education activities. So you can you can help other people in different places in Africa and other world.
Right.
So be effective, be good
Right.
leader. This is important.
And if your LEAP application gets turned down twice, don't be discouraged.
Yeah.
Apply again. If your plane gets canceled twice,
Cancelled twice.
persevere.
My fellow is cancelled once. I told her you should apply again.
Right.
So you should be persistent. And my fellow also applied for a grant and didn't apply. No, you will apply again. You will get the chance if you were persistent, and this will help you in your career.
Good. Well, I want to thank you for being part of the Oral Archives and congratulate you for the progress
Thank you, sir.
that you've made. You certainly fulfilled the goals of the LEAP, and I think you're going to accomplish many, many more things to come.
So.
Good.